Hello students, welcome to the discussion on Economic Survey 2020-21. As part of the discussion on Economic Survey 2020-21 is concerned, we have been discussing about the ideas of volume number 1, which are much important to understand the economic nature of the India. So as part of that, we have already discussed about the 4 ideas of volume number 1. Now we are discussing about the 5th idea, which says that healthcare takes a center stage finally. Now, as far as the economic survey is concerned, as far as the 2020-21 pandemic is concerned, you all know that the January 30th, January 2020, the World Health Organization declared that the COVID-19 pandemic is going to be the global pandemic. Because of that reason why, and as discussed in the chapter number 1, it was very difficult to save the lives and also livelihoods at this unprecedented pandemic. Now, this health crisis has actually transformed into economic crisis. We all know it. And the relationship between the health crisis and other sectors is also being analyzed during this pandemic 2020-21. Now, this COVID-19 pandemic has significantly resulted into a country must concentrate on creation of the healthcare systems, health infrastructure, and a country must be very careful enough to understand the outcomes of a particular healthcare system. Because of this reason why, this economic survey is also concentrating on the relationships among various sectors with the healthcare system. So it significantly evolves around the healthcare system. What could be the policy paralysis of India as far as the health is concerned? Even though India has responded fairly to the COVID-19 pandemic during the pandemic period, even then India is supposed to increase its expenditure on the health. India is supposed to increase its outcomes of healthcare systems. So we will discuss one by one. Now, as far as the economic survey is concerned, economic survey explains that what is the relationship between the healthcare and other systems, how the health pandemic and how the health crisis may actually transforms into the global economic crisis. Now, the second phenomenon is that health infrastructure. Health infrastructure is much needed to counter the future pandemics in the near world, because this pandemic may not be stopped here, and in future some more pandemics may occur, and to counter this future pandemics, health infrastructure is much needed. And second one, the health infrastructure or healthcare systems should not be saliency bias. What is this saliency bias? Suppose there is a COVID-19 pandemic and we are responding with various measures and we are getting some output. Saliency bias does mean our healthcare infrastructure should not be saliency bias, means the policies taken by the government which are giving some outputs may not be same even in future. That means just because we have introduced the strict lockdown, we have got some results. We have got some V-shaped recovery. That doesn't mean the same will occur even in the future. That means the saliency bias means you are supposed to be engaged with the future difficulties and future challenges too. For that, the country needs to adopt the world-class infrastructure as far as the healthcare systems are concerned. Because of this reason why, economic survey suggests that the national health mission should be adopted by, and the suggestion given by the national health mission should be followed by both the center as well as the states. And because of this pandemic period, we have seen that the physical contacts have been reduced. The physical isolation has been followed. Lockdown has been imposed. Contacts have been reduced. at this particular juncture, telemedicine should be encouraged. Telemedicine should be encouraged to go through with these kind of the pandemics. This was the main objective which has been actually suggested by the economic survey. One more important thing which has been said by the economic survey is the spending on health. Spending on health has been very much lesser as far as the India is concerned. At this particular stage, what economic survey says that if the spending on health is in between 2.5% to 3% of GDP, then it will reduce the out of pocket expenditure to 65% to 30% in India. So as far as the India is concerned, when we compare with the advanced economies and when we compare with the developing nations, India's out-of-pocket expenditure is much higher. Now this can be reduced by increasing the gross spending on the healthcare systems as percentage of the GDP. Now if we can go through with the 2020-21 budget, 21-22 budget, India's the spending on healthcare is not crossing 1.8%. The highest spending which was by Indian government is only 1.8% of the whole GDP. And earlier it was just 1.5%. Now this has to be increased to 2.5% to the 3%. And one more thing, what economic survey says that mitigate the information asymmetry, because in India most of the healthcare systems, most of the hospitalization, most of the outpatient, now 75% of the outpatient and 65% of the hospitalization is actually done by the private hospitals. Now because of the private hospitals are gaining majority of the healthcare systems, but the information provided by the private hospitals is not symmetric and not in conscience with the government standards. Because of this reason why economic survey suggests that mitigates the information asymmetry in the healthcare system. And what economic survey also suggests that there is a greater need for the equitable, affordable and accountable healthcare system. There is a greater need for the equitable, affordable and accountable healthcare system. So if this is being ensured in the country, then we can also face the future pandemics. And one more most important thing which has been said by the survey is there is a greater relationship between life expectancy at birth and per capita income. Now see, what economic survey says that if there is 50 years is the life expectancy at birth, if it is increased to 70 years, which is the 40% of the increase, may also increase 1.4% of the per capita income. That means try to increase the healthcare outcomes in the country, then it will actually also increases the economic growth and per capita income. This is what is being suggested by the economic survey. And one more most important thing which has been suggested by the economic survey is India's healthcare system is still behind, is still not in consonance with the developing nations as well as the developed nations. When quality access to healthcare system is falls even below the middle developed countries, and India's access to healthcare system falls at 145 out of 189. It has to be developed even more. Now as far as the health outcomes are concerned, even though India is better in IMR, under 5 mortality rate and MMR, India still needs to go through with the reduction in the healthcare outcomes, or it has to reduce the poor healthcare outcomes. Now, India's out of pocket expenditure is much higher even than the lower middle classes. And low building of healthcare, low human resources in India, because as far as the WHO is concerned, for every 10,000 people, there has to be at least 44.5 people human resources should be there, but in India it is only 23 people are available. That means the quality outcomes and the stringent outcomes should only be possible through the national health mission. And also economic survey suggests that the Pradhan Mantri Jan Aushadhi Yojana has also helped to get the larger outcomes in the various states. So, in this particular chapter, what economic survey suggests that health is said to be the central aspect of any particular country. Because of that reason, why ensure following and implementation of the national health mission, ensure to increase the expenditure on healthcare systems, ensure equitable, accountable, and also affordable healthcare systems in the country, ensure mitigation of information asymmetry, ensure to spend the whole healthcare systems in the telemedicine. So these are the things which have been suggested by the fifth chapter.